TV Oborabu Wagusi. Etaya TV Oborabu Wagusi.
Mwanchumuri ya Etaya TV kera litikolie ikiana na mwana litikolie Jumanne chinsabira na bego chinsanye nigo tokomera naye elitwa ko manyonsi bunakorekanire kuri wa Chinkongo au
Nime kimanyerero Jumanne na nigo rabe gukumirana na inche Evelyn Osero
na inche Eric Bosire
tokubwatira nabari kibaito ro kumanyanara yabereka watka korwa se chinsinyo aimes ya Kenya na se orogongo rwa gusi
nyorobo igontunyara ka batogo twara barayana mwana korwa sensemeria ya gesiasa komurekeronsi buranyara ka bakao korekana ime na isiko yensi ya Kenya
kira litkoria Jumanne ime kimanyerero Jumanne ime Etaya TV
Oborabu Wagusi.
Etaya TV Oborabu Wagusi.
Yamono mwanchumo ligereria Etaya TV gotwaganyete mogeni taika studio na ende oikire egere to kwana mangana lengete obochenu matters health ekiagera on Tuesdays na botu wabegete nsemo kulinde kero konyore bintu bichencheti na bakonyora tubwate topic ende but for today nigo tubwata mageni itu tukwanira mangana lengete obochenu na kitoko menya biyake bochenu ngaki status chobochenu waito bole ase county ya Nyamira ekiagera lende mbuya twacha twana koewa inki kegenderete gokore kororo sibali motari Nyamira osimotara ikororo na bali momenye tororo mwa get to know what is really happening on the ground nimotara debange kenkera korekana kwanyora nga gwatebi mapema bone gasio no kogenda kuligereria ngaine na maena bono waziri ate bando cho na timanyeti bintu that's the reason to ko by platform bacha berera as chi docket chabo chiri batenerete no bokoreri nasenga nche uchinsa cha minyokire cha butukire chideke 30 osenusu saigore chinsaibere kerenga twa wato ikakero kituge kwanere for the remaining time na then doche ngantora nyoro na nyetu anyori rwasinini kolende twasabiro kwabera egera tuchiku cha interview asema nchene ntingane ta breakfast show Mama Africa Sara Nyarangi Ontita mzee wa kazi Brighton Makoli amesonga kando kidogo lakini amehakikisha kwamba maji hiko hapa juu kati ya mimi na waziri kada tuko na gukwana tunako siba match water is live ndoche Frank Mayunga the tall man kurasa nsemo ya camera and of course my sister Ruth Aluda na erurasa nsemo ya transmission nigasinga nchego takora chingage nganchere tumwaregane magani ito agukwanie omanyango ikirase studio tumayo chake nkwana ito asemambi ya bono. Good morning waziri.
Good morning.
How are you?
Ya ndegaki.
Amatuka mangi.
Matuka mangi.
Karibu sana.
Ayule.
This is your home all the time.
Asante. Nje na wokiro kwa nae.
Yes.
Na ukwanira mangana he county ito ya Nyamira. Wana.
Kwani mwanchumo ligereria amotai wa ikirase studio.
Asante sana Sara na ikirase studio ya Etaya TV.
Yeah.
Kwa kwani gwakire uya asumuri wasumuturigere tukuru. Cha samarita Dr. Donald Mogoi. Muminita bwe awachenu ase county ito ya Nyamira.
Good. Bia mona sana naro kurugwa kefa kiriri marindi sironga ndavirenga salimia yeye sana. Wish him well. Kurugwa kefa nero tumere message yeye ntangani kabisa na
kwani kabisa na inchi na ukwandi kefa bia mona na kwani.
Ndavirenga salimia yeye. Waziri tutara enda tamba ya lengete afya nimete yunere docket yao kabisa akirende tiga turara kwanira what is happening really asinse to ya Kenya yani buna sogo chakere kiagera you live here no ruche mangana agenderete amangana ya yabarai batakari kuigwanana muraita ko gutwara musangirikano ye akore na maskani no ndeta gutwara akore na maskani wika chi fracas chibe. We have seen what happened the whole weekend na kurumagega nkiora comment kiagera neba tutagira comment mono asayo no mokenyore nebi gongo go affective in one way or the other
nekene ngo affect chire onye karabarwanire uza kire fracas iri abere might eventually as abantu bari bakulandi nyagitari bari bakirwana chiro so no uriyo sirire
yeah sure
uriyo sirire mochari cheita koreto na kuno gotomente gasi Etaya lakini gukwanira rinda sabara ibaito murembo matenegentekia sana
sure thing
na mbaibira ba tote utujigo kurwania abandi uri kurwani mu murumino ne neba yago omuntu mwasomete nere ne kasini yago na mwana siasa no ari rero nyuma bigo cyo gutokorora kukwa mwiri chukura yago gendaga ari omuntu munene tari kwira na sore ai ne neba yago kamugendere komenya tudumisha murembe tigo yoko denta ya rente yoko ni chisera chia yaoni uriyo gotegwe chikorwana itari murahi ikane itari murahi omurembo ati oyo gogotoma no yo gotomeka who is unani ako na makosa kubwa who should we blame oyo gogotoma no yo gwanja utomwa bonsi lakini nenda singe njonga you are a leader ayo gotoma I need leader as a leader you go take a role model as a society tinko imo kaboni ga ningando mwaziri wa Nyamira ise county ya Nyamira we obochenu ndigia abantu bachiko bungi mba convince na baire chibeso na kodire kendigas na bachiko itanyarebe okaboto mugutano ya sigete ni barina chibese na bako blame lakini ninche mpate blame nene ikera ninche na kerengere ninche na ge fund ani ninche na maitenge ganga ya niki abali bandi na chibesa na guranya no butaka bwagera baira chibese chiri nande bachikurwa lakini ndinga ikitari kinga ko excuse ngi ochiku oitabanto so no to blame once leaders baitu na bako blame dumana
na kikangi waneta kwa waziri kiagera bono we only have one financial year
etore democracy
yes
akiro muntu na gwatira itia se katiba yote wakiria aganetikote muamuzi ni mimi na wewe una wananchi why don't you let us listen to what everybody is saying tutigire batriende kraba toteba tutiga matusi na intu na tutware decorum tukore mikutano yetu ire bwata amani then so mwakonde chikurango bachire we will vote voting nearly together the following day we will know ngowire yes lakini ayuko itire ere buge mwe ngo ganda bana bayo simba liko anda school familia yae kwa itigire mechando iko igoti tu dumisha amani tegera kiromonto you will have a time you can make a decision kuna ningo gocho ko ambera
yes kiagara waziri bantu mbago BF ko buha chikure chire mambi tare 15
kuranjia mambi tubwa tumwa ko muhima tubwa tumwa ko muhima chikura chiabe kutare 10 mwezi ya 8 2027 one year to 2026 we still have 1 year
thank you so much asekerengere kiao ayaringete siasa chiense ya Kenya kiagera wikatwale kora chakera abo the trend and the speed at which siasa chigo korwa asara chikororekana abantu bakorwana so easily bantu bataliko twara baremererio yakwana ko reno yakwana it's really wanting something has to be done abantu they have to come to their senses bamanyenga chikura next year and chikura ngocha chira ndi chagenda back to the topic of the day waziri amayanarari ali Nyamira county osito taraenda kurtwe karanstegega nyakitali chira mwale ko change chiru korwa se kanisa something like Riakwara and Nyamakoro to what's their status chachira se county
No, njira cha county. Ochenchi inkeri gento ke kyo kukwana. Litu kerimo. Ikiagera bali bachiaga chite kanisa. Uika yanchira ne guchirwa. Ne kanisa nero ne wate stand yae. No gusie kuweti nyegitari chunga nyamakoro to. Na liakwora. Onyenke miranja asiegetu. Chiasegetu na Kenya Medical Practitioners and Dentist Council. Sengi nchunga ebintu mbire. As standard style ko meet. Kagara chiga siekwa. But still into ganda to kuba aji. Leaders wabo na wate viringa kwana na the leadership ye kanisa. At the end of the day, provision ya healthcare ne serikali, and no serikali ya county as primary healthcare, ne ritakere go oteke jukumu hiyo. Uno manyene kanisa, usotenrete kanisa. Ne banga ne nyagitari oteto Quran. Ngo ikere nga kigete ya asinya. Kuna bono Quran dispensary. Dispensary che serikali chirosa. Kero kwando otekere kurwali kubosa. Tuwakile mkuruasha. Wafanyikazi walibao kwa rasi dispensary cheze serikali, tubawa kwa mshahara na serikali. Une kanisa geruko igura nyegitari, kwa kana wafanyikazi, kwa igura Mario, kwa gachama gachari. Cost sechi gachonspi no agacho nyokwa gachiro su kwa gachitakare. Wisu kunya serikali nintu tokobeka Mario kwa into tukubeka abanyagitari egere nyagitari egendere gokonya abantu. So Korani nyagitari asogo chachi abantu ngengo chachi ora singencho sine kanisa. Next doe dispensary gero ya serikali. Na beko bigizungu mukuti. Asori na bonya namparo ire mbali go choro. Kiagera bono tugutwara abanyikazi bayisaine kusebere babwate the right qualifications. Tugutwara Mariogo aliatakire aisaine se are the right quality. Ya geranga no nya registration yago yaba kongwa kanera. Usonya yabira kongwa kanera ugwa kanera ya sinyanga standard chirotokere commit to commit. But in tune serikali it's possible nga ngora ngoro isukurigereri we are progressing. Health yetu kereli tuko nguskatore step. Na that step to kuna guska ngoto make it to sustainable kubwa anybody else.
Okay.
So na kingo te ya wa nyamakoro tuna chinyigitari chinde chia kanisa anene mone kanisa ya SDA. Chikani chia sigetu chinyigine chia kanisa ya SDA.
For how long?
Vanchira and it's now more than a year. It's now more than a year. Na you realizing as a serikali to also even less one children. Yengi nga so much womonto. Atara kwe gore gita. Igo ko ko mo.
Ige kwe tabno mo.
Igo tabno mo. Entunto we tabna ba yi. We kebe very formal. Na egere ma binto beso ko problem dinga. Etwa we trespassed. But that does not meaning abantu wadia ntore engereti.
Okay.
Nyamakoro to. We eventually intending a canto make a dispensary or if the church doesn't agree. Kia burumburi neka uwe kanisa na building ine kanisa. Kubara gani ngambari ko kuwe kanyagitari ororo ne jukumu ya serikali kuhakikisha abantu banyamakoro to konyana bali kwerende afya. Igase budget yo mwako yiga nindo chenga ntubigete bitoki bikorro korranga ki either torino vetieri yenye kanisa ge kwanza. Wanya tiri wanja to ansa kwa gacha nyegitarienda.
Lakini neike kanise ehange kiagera tubuati capacity.
Yeah, we are still discussing.
We are discussing and probability nero ngane
Tindo chingambange.
Yes.
Of course in a baramba water conditions chavi to bira baraga ninga kipata gete bikoru. So there are things to kona kiara no gukwana. Ikekora ikento kore kerinto konyara. Kiara wanya before isi ekwe abanyagitari wetu mbere barengwe sinyagitari. Abe serikali ye county. Lakini nene nga kiara kire nyagitari ne wate sponsor yae. Kanisa ya Catholic ne wate nyagitari chiae awe seri sponsor. Serikali ne wate nyagitari chiae seri sponsor. Obe na esaru ikore nyagitari rero ine yao na sponsor na yo monyene igekero ukoligie license yo operate nyagitari igukunyiria ibuna no monyene nyagitari ya bete kaligiwe license yae ne kanisa so ono ntune serikali togoso imigonga mbugu uikoe guri bagari ogoso.
Okay. All right. We hoping ninyale kane very soon. So lende enyagitari yewe functional. Right now ngaiba ku access. Abantu banyamakuru.
Ase Gesima ward. Kere yenye wesima yonkoro tere Gesima ward. Tingi mwari ngeno mwa MCA goroga.
Yes.
Tuwa nyagitari ya Gesima ward ke wati nyagitari bire chilele wo for by the way. Esani na Gesima.
Yes.
Tuwa macheno, tuwa machuririati, tuwa nechine njiro. Nta inyora mali yetao. Lakini iko chine gitari ya chike chonspi ko basafu chire. Lakini nenda se dispensary. Ase dispensary sana. Dispensary gere elia kerobuate a common ailment ugoikera angena buogo. Standard city got every 5 kilometers as Kenya utakere tuale nyagitari. Nyamira tuwa nyagitari 116 cha public cha serikali 116 3900 square kilometers in county yeka rokuri oranga every 3 square kilometers every 9 square kilometers or every 9 square kilometers tuwa the dispensary so tuwa the nyagitari which amounts to around 3 kilometers kuro dispensary ya mochi yende igonga density ya facilities ntoribu yake but that does not meaning it uniformly distributed na boko ganda one section konyoranga chinyigitari chiri chinyinge lakini kwa yari bichi chiketenga abantu bebenga nyamakoro teyu esege jichikeri ntobwatika dispensary yororo kago konya abantu bwangu so that is why we are intending the areas togocha kwa gachi dispensary na kuchumutu andi chinde chiri chiagachire tutaraigora
right
tocha koigora.
Okay. Sana. So lende mwanchumulia tole na waziri Donald Mogoi, waziri bw'obucheni kurase county ya Nyamira tokwanira about amangana yebirengo by'obucheni wase county ya Nyamira okwanira about lyakworo na nyamakoro to as it is right now agine watabirenda bamenyi bachinse mechunga talinga bachandike basinyira se bakonyora obokoreri kulende yali gochaka babu yamono ivo chi dispensary chi gose facility echo chia gokora chire emirimo whichever onyene serikali county era chire chikore onyene kanisa ebo kenaende ebe kemerobelio nyagitali chikore igera ababiya because ekena kiekerenga gyo kotwara chinyagitali egero birengo byo bacheno abantu bakonyekera angegabo waziri about generally nyagitali nere kwacha chituka kwaniraga last time was it Nyamaya or Magwawa nyagitali nere ya renge underway temetenga yekire bona was it Magwawa gose Nyamaya
sara chinyagitali cheito chinyinge nchira at different states ya change tuansere nyagitali te referral nere underway ina ikiegera story on a trajectory yoko make ari level 5 na kwa make level 5 means to ment specialist or was a specialties chirichiko offered or to ment bifaro last time ka tuaringe gaiga na the major problem to what issues chiarino asire rifaro machines chito kwenye chia gotirikeri chia go to we had 6 machines chia go to I think 2014 2015 kwenye chia gotire so they are giving us a lot of problems so now we installed a completely new unit that can expand with intention and ending this financial year once to muisonde we will again add more machines egere tunyara go serve abantu it looks like us in Germany ya pressure diabetes want to ita wangi sana wako into kidney failure wako into kidney failure the only thing you can get is dialysis so we are doing that and we've done that 2, the same referral, need to change CT scan to MRI. So, it's work in progress. When you're a president, you Nyamira.
Yeah.
Now promising he was going to give us 1 billion to Agache Nyamira.
Yeah.
Another 350 bed hospital commented the current 350 to a 700 bed hospital.
Yes.
It's work in progress. Ochichenya gitari ito ya Keroka, now it's also work in progress. Last time I got to Aringe, we expected an ambulance near Robono and Jachicha.
Oh.
Keroka, we expect Neronga because it's serving the other side. Uskuli Nyamira ite topagira apparently into 2 parts. There's a part ya Bugirangyo, abantu bagu access Nyamira as a referral services. There's a part ya Bugetutumuina, abantu bagu access Keroka for referral services. So Keroka ire nero na trajectory nero eventually chikobe level 5. So kobe level 5 really specialties. So we had said we will need to hire specialists against the Keroka.
Yeah.
But into what the County Public Service Board. One County Public Service Board. Yeah, last week induction to a County Public Service Board. So next no ko hire. So we are thinking to go hire and we will hire specialists to have an Keroka. Keroka should get a CT scan. Nero, if you can at least see these specialists wagoja mbagwate vifaa autumie CT scan. We intend to make nero arino unit oro. Esa the side ya Ugetutu. Borabu side ya gocha Kijauri na parts ya Nyaribari Masaba. Ichiri no egeri Kisi County. But at the end of the day abantu baria healthcare and what boundaries nene. No nyegi Nyaribari Masaba geri Kisi County na wa access Keroka bwangu wa access Bosongo. So we intend Keroka have a hub ya referral. Then because into the na services chinde closer to abantu. Ekerenyo nero the hub ya Nyamira North. So we intend Ekerenyo nero because Ekerenyo previously to Arengegega, you remember we opened that theater there. It's functioning well. To comment to the bed space Ekerenyo. Says that it nero ikine the bed capacity to around 50 and to more than 100 beds. Ekerenyo will also eventually have a renal unit. Ekerenyo will also eventually have a possibility MRI, a possibility a CT scan. Then within now that Ekerenyo, the other side into water Nyamusi. Nyamusi nero, it's also on the same trajectory. Currently, we are doing a mother-child unit. To call it an inpatient unit. It's in use. We are mother-child with a theater. Theater. We are hoping soon in Koirere. So that in Yamusinere Koriki. Ekine. Yeah. Then another one, again, sides Burabu. Burabu has a constituency or a sub-county. Burabu gere the side ya Kijauri, SCC, Nyansiongo Ward. And parts of Mekanene, Chepilat. Those people who access comprehensive care, so there is a plan for Kijauri. Kijauri also we are doing a mother-child once very soon. Once, that part. But there is another part here, Borabu, Kiavanyo Ward, area closer to Nyamira. But in area so there is a facility that we are currently doing in Mokomoni. That Mokomoni facility, Nero, it's a comprehensive facility, which covers level 4, so that they serve those areas. That sometimes labda ekonya and to very itibo ward, very close to so that is also work in progress. But eventually, even to itibo ward, we are also thinking either Kenyoro or closer to us the National Polytechnic here. To chikobe kora facility comprehensive to serve Havana Polytechnic, but also to serve as a referral point itibo. Then now this other side now Kitutu Masaba. The side ya Manga. Yeah. Kemera duwate Nyangena. Nyangena is a level 4. But in Erto Bugatti Theater, na some other services choko make a real level 4. So Nyangena, we intend Nero very soon to a theater. as we also do manga, because manga here nyangenere on this side of the road and manga nere this other side. So manga, as we do manga, the inpatient unit plus the comprehensive services. Then now, to teach now the health centers. The health centers, Getare, Tinga, Nyamira, Tombe, Tombe, Nyansangyo, all those health centers. Our intention is to achieve a hub here, some diagnostic, a maternity. It goes have Iran Yarkoba, like a referral maternity. Then, Tinga na Nyamira na Getare na Ige na Itambe, they are planning and on to eventually to uplift each level 4. So, so there's a lot of things very in progress.
All right.
But you can't sort them in a day.
Yeah,
but
sure.
pole, we are moving.
Biasana waziri, now that the budget no mwaka wichi besa tuli, what will be the priority? Kiagara wakwane chisaidi chumano what will be your priorities? You cannot do them at the same time. We prioritize entugete. To me, you ya nyamusi, njenomba interest amangana mother and child unit. Njenomba interest mono mongina wose na bangina waitu bona tokora bago chandika. I don't know what is your priority before ndarasa machujumbe chirega.
Current priority. Number one, the first priority to get the back on. We've lost staff abange sana. So it already stretched very thin as a staffing because of natural attrition, retirement, death. A few have died, but others have migrated. Many of our nurses are moving to Kenya, to Canada, Britain, America. So we need to replace and increase our numbers slightly so that to serve abantu waitu na kolesen exhaustion as a staff here. So the first priority is how do we recruit immediately so that to tokonya wafanyikazi waitu from being stretched.
Yes.
Second thing, a priority ya kabere.
The priority ya kabere. How soon are you recruiting? Because now the board is.
We just finished with the board induction. His Excellency Governor, he got with instructions clear, that should be the first business. So, no nyende ronga na chichaga iga, intervanitia wantu, because we are going to some meeting na baraku, koranga ki that recruitment. So I'm hoping if we move faster, to call 1 or 2 administrative issues around that recruitment, we should possibly have an advert before August.
All right.
Or very early. Very early in August.
And who is qualified? Is a qualified nurse from Kenya or from where?
You know, the recruitment is an open process.
Okay.
Every Kenyan has a right to apply.
Okay.
Every Kenyan has a right to apply. Number 2, wafanyikazi wa health, we don't serve a county, the region. Njivie kaze ngosaf, say it over song, but I'm working in Nyamira. Before I was working in Laikipia. Before that I worked in
it's open.
It's open. So anybody can apply as long as you're qualified.
Only qualified.
There's an opportunity you can get a job.
All right. Palienga mura takuira wose mura manya.
That is what we are going to
discuss
up.
Today.
We are going to farm up.
Right.
We've got numbers, yes, but we need to farm it up. Based on a budget, but the numbers are not going to be bad, particularly for nurses. West of what issues, the numbers are going to be bad. Are not going to be bad.
All right. That's very nice. Ikiagera muharabe ire kurugwa chete gantu akwaneta mangana you understaffing. Lakini watabanga they are really working very hard balibaro to make sure nkuru bali service and tukaranga nige intake. But now that the service is on board now na ndi mwabakore irenga na kigasi gokorwa genda bwangu tonyora bantabo egere service yokorwere effective. The second priority you were talking about.
Now the second priority we started our revolving drug agency. Towards the beginning of June, we got our first batch here supplies, Kuru Kemsa.
Yes.
So our second priority in Ringa was sustain our drug supply, such that Nyamira, kakwa ni nyagitari to serikali, taba isokote bunga yandu lio kuru
Siko.
So we are expecting because the first batch into a quality, now we are doing a second batch, plus konyora supplies, CECM setari kutuara, so that to sustain amarioga si nyagitari change. So soon we will actually be calling abantu wa Nyamira, overtaving now our stores are okay. The revolving drug financing is on, fully operational. Even if you prescription, somebody that take prescription, I'm about to agenda a pharmacy to anything.
Yeah.
They should be able to source internally. Why to bring the revolving is to enable non-very rare. Very rare, utali nyora essential list yaito ali revolving na wako kale kuendenga mechanisms inchiroro choko enda ba resource bakora entere the same way okora enda no private hospital sometimes oko nyoro tegunga ili okori yago ikatori import no enkuru India ndiyo gaiga lakini nkuliriki kutori nkuri so story koru India so gusikuru America gus from anywhere na wako resource wako tevi inchu after 2 or 3 days onyore ili okori yago we want also to go that direction inga there is no need yokurikira umuntu nga kenda isko rusiwesa mufuko korea origili yogeri. So that is priority number 2 nga we make revolving drug financing sustainable and completely functional.
And by the way, waziri eyo itakuwa kitu ya muhimu zaidi kiagara uroira bange most of the time kero okora etaga kwarora akonyora babange tichiraini asichiduka cy'abantu nyene kurigiri yogori yabura mali actually akonyora ririgwana to konya ndiyo malia bono kwamanya guchikole kurusi base muko kugura ririkwa rocho ku afford kugura isika na ririre mali ase pharmacy nyagitali. So I think that is very in order konyora that priority ya mangana ya mali yo gutuka no ndiyo koranga ndi gutuka endo nyandiri gutuka bono iga ndiyo gochori nyore yugera konya abantu baita bange ase okini birango byobochono. I think that is very much in order.
So we are achieving because our assembly has been very supportive. Mugabanari extremely supportive. Gotokonya ko realize ekyo. Budget ya intubwate, chibesa ntubwate, the mechanisms to access in place. So I have got no excuse at all on that yumuntunga. Inki as soon as before the next 1, 2, 3 weeks inki yakogera muntu Nyamira and this kuga timba excuse because in that time.
All right. As much as mukubeka that effort from your ministry, which is very good. Mwatemera kulira liaro na ki amalioga ya guchigwikira abantu baitu because wikanaro obeke enchira malioga ya guchigwikira abantu baitu gatima muntu tada bulioga lindiyo liro na endate bugwasoke. How are you making sure nga ebinte binkwanda bire hand in hand to korumukia mokorumukia with the ministry lakini nyora nga abantu ngulira balensa basinyiro konyora malioga ya
now the third priority one you answer that question. Kerna rengi last time now the thing we intended to digitize through amangana ya a paper based working to end a digital system. We are actually now there. Most of our facilities born at John Speed the 116 which are on a digital platform. Kwa roche muisondo nonyesha but batageti bono kero kwa nenya gitari inga mwanzo gutumira OTP inga gusibanza konyora paper based claims chitekero kwa Jones be digital. Nyamira we are also on board chinya gitari jetu cha public. Isikubo ya ntawangire na wanyora ko tenga kera nenya gitari yetu yako basabudi ne tablet. That is the digitization.
Okay.
Now that digitization igebwate mpaka a section ya mariogo. Kiriogo ria jire nyagitari kusobo dalio lirie. Riko ilirese system iri. So it's possible even on ninje.
Okay.
Asingo ikaransa. Kusema mugaba na soon. Asago ikaransa. Ase dashboard yae. Akora nyagitari kita mariogo igebwate na araya.
Oh, okay.
So which means ngekaro tukura mariogo feasibility nero. Taringe tugutumia paper based management ya mariogo tugutumia digital system. Na nga tugutumia that digital system na bigo tuene bokumanyanga karukwaya nyora rioge rigandiroro and including care what mumuntu isiko. So we will not allow our staff care abange but munyagitane rukwa mwandi okyoko. So we will not allow bantunga go exploit abantu baiteka babuje kinyagitari. And that is why we digitize. So we will have feasibility. So even supervision will be easier.
Okay.
Before.
Yeah.
So that is I'm telling you, we are every day we are moving.
Okay.
And we are making progress.
So far mwate mira gukorera it's bringing out. It is very positive. Mbiya gukorera so far.
Mbiya gukora. So far. Of course, just like any other digital system, there are hiccups here.
Hiccups and challenges.
Going as staff, are frustrated. Tablet, go see the system will work. Go see I'm renting a message. You don't know understand. Digital health authority. You to kill lingua update the system. Into the work or take or to be so there are frustrations here and there. But to me, I look at it from the positive side. We are moving. We are no longer where we used to be. Now, no, you know, you go to me a tablet. Before, it are very difficult. To me, they are able to do it. So we are moving. We are moving, and that is for the better.
So you are on the right trajectory in terms of health. Matters in Nyamira County. Myself, mimi ni waziri wa afya eta breakfast show. Ona otogote mako koliginga ki.
The systems
Yes, we need to follow.
You get to inform people.
Yeah, sure.
Na koranga ki so that digitization nero chikotokonya mono sana asuku hakikishanga bantu baitu mbaligo kuburudi hogo nandi liroro. All right. Viyasana manche muligereria mangana mayasana korose koncha Nyamira under the Ministry of Health ekorawa na Dr. Donald Mogoi korwa county ya Nyamira amangana yobo chenu gali bya bantu bali bago chabarate ba Nyamira ya ndoro chikende ebinte bire torarati gona mangana alengete politics ekarota kwenda facts na ende to bwate objective ntubuna abamenyi ebintu byakorekana nande bigendere tokorekana naende is on the progress inte binge biche bikorekana buyayiga but the priority na waziri atabire is about recruitment of new nurses na abanyagitari kiagera abange bachire for greener pastures abande basirire ondora bagusira na araka abanyagitari na bagurwara kwe batigire gaps they have been struggling a lot. Again, good news nailing abono anytime from now before August na bakonyoranga staff ya very reinstated gosiba baisanire nkonyora moro bokoreri ubiya but that one doesn't meaning atokonyora bokoreri ubiya as of now. Still you work as a facility na bakonyora bokoreri kyagera bali baro mba understanding and into toron and we have to do this na priority chinda atabira mangana ya maliogo na kikerekerenga goseke go cheke nene monto kulikerwe liogo is not there what abunga genda uchikuliya mongina nyaguye tunda igo ngainkwenda kuligi but ba achire ne system elie kworokinga maliogo gitenara onyeta iyo na kibako ya prokiwa na ende na kia kubwati waligererigwe nga mongina oli naye weliogo gete because bono vitu zimenda digital na onyena mangana yo boibi bono nechiko ba kongwa kikiagera they are monitoring to make sure nga services na delivery nkirano ngwikira dinere gochasaba manyibe county ya Nyamira na yanda manga atebiri gocha
we are really proud as a sector ya Obochano inaendelea vizuri as a county ya Nyamira. But waziri ndongera wakwa na litanganinga, it's now you are having Reno unit enya ose machines chinya. Lengo is from 2014. How does procure of equipment chigokoro? Because I believe in each financial year there is money chikobekwa senya gitari. Nki chigokore chigose mwako ndango mwako yo tigatogoreke mwako nde tigatomenyeke. Because 2014 up to now it's a long time.
Maybe ntara kore kwerende as a staffing still into what another category ya staff.
Yeah.
Awakuru UHC. UHC staff were on contract, initially a 3-year contract, and another 3-year contract. Year at Ikaira May, Mwaziri Duale, a government 1 month. They are also in our thoughts, within our budget, but I can transition to UHC, to national government. But just counties.
Okay.
And that money has been factored as the budget chetu. Iko wono nombarako.
Yeah.
Very top priority nga toka recruit. Nambaraku nga wako converted into permanent and pensionable staff na Covamed County employees. So that is also immediate.
Abaiga ba kokone
UHC.
Ababebi nyoro.
No, UHC, not everybody nyoro. UHC, UHC mbare staff unyore 2020 litwa wate COVID. Staff mbari ba better recruited on a 3-year contract. About konye bari strikes all over. Because they were not being paid a salary SRC.
Yes.
Wakansa wakone salary SRC. Now the process is all no kuwarusi ngeke wakurusi ku national government.
Go to
county.
Okay.
Na number 2 ngaki terms chawo chikurusu ku contract ko permanent and pension. So that is also top priority.
Oh, that's good.
Now ukwanira
equipment.
Abandi remember abandi ba county barabu abari permanent.
Okay.
Ntobu ati kwerende. So bari say county bari abari permanent and pensionable. Our job is to ensure ngo mushahara obo akaniru bawate medical cover yabo. Na bawate the right working conditions. And those right working conditions,
yes,
na chichu wetu ngono whatever we are progressing. Equipment, we are progressing. Amariogo, we are progressing. Working space, we are also progressing. So, because we can't do it in a day. Ukwane equipment. Nyagitari, na bingi buogo. Tenge karukugura tutebe mbuogo, nubo tenga lero, kwa uri getanda. Ne mattress. Toko imoka gozi, tobu ati getanda, usene mattress, uimoko chikugura TV. Unless priority yao ya kabeti.
Priority yao gerere.
Amba ibera karuko agorire TV, tari TV ngoko igora kero mwaka. Igoko TV elirimo. Ego safu emyaka gete, kego ikebe obsolete. Either technology ya change. Ose ya sarikire.
Yes.
So even equipment chanya gitari, chibuate a lifetime.
Yes.
Chiko colleagues.
Yeah.
That lifetime, yeah, those machines, to those old days, each one of the Reno machines, lifetime, yeah, one area you get. It actually lifetime, yeah, require around December, January this year.
Yes.
So we were not extremely late, which replaced. This was at the right time. Because we think about a CT scan, Nyamira took a CT scan, in MRI, it's not that into what is CT scan, to what is CT scan again. But it was a CT scan in Renkake, and now baby, it has also served us for a time.
Yeah.
So that technology is also becoming obsolete. So we need to modernize it, buy a bigger one. It will serve the right numbers. Number 2, it will the right quality. Yeah, tests. So the technology keeps changing. So it's nothing a kiro mwaka kitobe kechiwe sichoku already no machine. Kia to kugora yemo teko serve. Kera bantu na bange. So we've bought 10, but we intending because we are seeing the numbers to chiabanto, but to diagonalize. Number one, kidney failure, near and nake. So we need to expand that space here. ya dialysis na machines. Same way ngatorengere the other equipment. Even theater, equipment chiroro chia theater, ngakinere go ikago to replace. Even laboratory, equipment chiroro laboratory, ngakinere go after chia service a certain period, go to replace. So it's not every year. That is where Togo prioritizing now. This year, neke Togora. Next year, neke Togora.
All right. Pia sana bano wakivikira so clearly waziri na tumeget. Asante zaidi. Engana ya congestion na kimwa ya address digitally kiagera nowadays na nyora ntubakorwa no nyagithali. There was one hospital where I was kanyora ntubakorwa nanga I want to miri inje nare goswa nyagithali na kimukariga ona ngarora bado tole back to analog ngakitoko karatole the sanity ya order na karoli nyagithali gwikara stega manyete nayo goswa ucha gosno yo goswa so that we reduce the congestion as well. Ne order nyagithali no mucho.
That system.
Yes.
It's literally a queue management system.
Yes, yes.
Kogocha, karukwantanganira, igore slotted. Nche number 1, na number 2, na number 3. So uno also as a clinician, na number 1, na number 2, igo. One of these are digital queue management system. But also, that same system, nero na ndego tokonya nero ku manage beds ngayi gitanda kiri nyagitari ni bitanda biringite kiri gutwara nyagitari ni gibwate bitanda 10 how comes abantu bara admitted abari within 30 which means it's congested so we need to add
another beds
some other beds we need to build another ward so ikero ku ngono wate nyagitari chiga kijauri tutage tokore kenyangena ekengite kiri kerenyo the bed space needs to be expanded. Nyamira, we need to expand from 350 to 700. That is because the trajectory na capacity ribono to admit.
Yes.
It shows in Atinare to congested. Can also ward chito na wanya no negetanda like spacing it cover between one bed and another every 2-3 meters. Kwanya oranga bone to vegete instead of 2 meters to vegete 1 meter to accommodate more beds. So that doesn't give comfort na privacy as Keromonto.
Yeah.
So for you to get that comfort and privacy, that is where now we need to expand the hospital. We need to expand bed space in other hospitals. But if nyare cover accommodated, to accommodate in those other hospitals. And that digital system is helping us to do that. So eventually, technology really is the game changer.
No nyina baba wo cha outpatient batakere na rito kwande bengi ko wendo they obwate number get ticket number
na next
itasaidia
sana. We
are
there. We are actually heading there and we are there.
Okay.
Because it's a digital system. Inga kwaru okwansira triage. Inga kwa so registration at triage it gives you a number.
Yeah, sure.
So that clinician ingwanga ari montari go cheisiko okobwa to koboko kuira Ontita is no longer tenable.
Yera konya sana igara ndwana yani mutete tomenya bakasanga. So you have your ticket number, you start na triage na registration bas ticket ina konya gotena ki number 3 ingia room.
Na kwa vere sabu kwa tumuzine laboratory. Na ore na number. Because laboratory is a karuchiro.
Sure.
Number. One of our laboratory, there was no option. Yogo chokorangeli Brighton. Essenge jobe nga Brighton wali skoga ekero saro ese system wikera there is no paper. So Brighton go ikatomu go laboratory from outpatient.
Very good.
Using an ambelia.
That's nice. Yeah. That's nice. That ticket number. Biyamono sana. I have a question here, Waziri Naro Kulikanga. There is a clinical officer strike affecting some counties, including Nyamira, in the next 7 days. Do you think it is valid, or what can be done to deviate it? Ni kama kuna nini mepangwa ya clinical officer?
Yes, there is a notice. Baruete. Yeah, 14 days.
Yeah.
But I think the issues they're talking about, Kerongo corrugated that notice.
Yes.
There are issues that are being sorted. Here are the main issue, UHC. Conversion kuru contract to permanent and pensionable. That already has been done.
Yeah.
Budget ya very provided. So tindo chinga kogoma what it's going to change.
Mumeambia wenu wa Nyamira?
Yes, and soon you will see us meeting all of them because they're on 30 clinic officers work. To 241 of them. Yes.
That's many.
Nurses, clinical officers, laboratory, even there are some doctors.
Yeah.
So to me, it's a done and dusted thing.
Okay.
Very permanent and pensionable.
Okay.
Second item vago kwanera ni career progression guidelines chiavo. Nyamira we are actually implementing them. We were actually possibly the only county or the first county as Kenya that recognized the career progression guidelines here, clinical officers. With a lot of course, with a lot of issues here and there. But we say because this is the current document, so even our recruitment, we are not going to recruit in job group H. Our proposal is to recruit at job group J, because that is what the career guidelines. Now, when we are better recruited at H, we pushed them, I think, last year. If there is 1 or 2 or 3 particularity, we will do it so that we have in concurrence in our career guidelines. The other item, CBA.
Yeah.
We signed the CBA in county. We are waiting ever registered in court. Once it's registered in court, na IPPD, the payment system, because that CBA, the only thing it was doing for them, go increase their risk allowance. And already SRC had given a circular directioning risk allowance here, ever adjusted. So to me, that is also not something that we should be fighting over. It's because it's serious.
Okay.
Go fight over something legal, approved. I don't see why we are not.
Yeah, sure.
We're not a county interested in a fight. So my tech nailing, well, they are justified. Maybe go issue a notice. But to me, we've made progress, so we should not have disruption of services.
Okay. All right. Biamono sana, they have nothing to worry about because you are ready to comply, and you have complied at some point.
Yeah.
And in case of anything, misunderstanding somewhere, there's always room for talk and conversation.
And we talk with them every quarter.
Okay.
The union, we meet all the unions every quarter. So even the clinical officers, soon we will again meet them.
All right.
Even before that strike possibly commences, if there are issues, chile nagging, an answer to, we will meet because we are family.
No,
even in your own family, where I say you must talk. Na wora gani kuganeti ogenda Dubai trip na no passport tubugati because if ndege hiyo kwenda mpaka Dubai teyo, so you must sit down not there ngomanyite
mubange
kana bana bara bategere ko yende school fees na ere priority keturaka ne fees tubaje kono walengeria mangana ya
Dubai ya chache later. There is always room for discussion and agreeing. Oikanto mokwanirane bintu mbiri bigosinya biamana sana. Mheshimiwa kwana about Nyamira referral becoming level 5. How soon? Because now at least you have everything together.
It's not my decision.
Okay.
I told you don't get standards. And the standards are
but
not.
You have met them, most of them.
We have, but you've not met the others. So the others that we've not met is what we are working on to meet them. I told you we need to expand specialties. That is where we are hiring.
Capacity.
We need to expand equipment. That is where we are intending. We need to get an MRI, and another CT scan, or a better CT scan.
Yes.
And possibly expand renal, and other theater, ICU. Then from there now, we can now be a level 5.
A better place.
But one kero konyora mbabwate checklist get ntambe sana. That checklist, to meet it is not easy.
Yeah.
Yes.
Okay.
It's work that you must do daily with a lot of investments. Yeah.
You are capable. You should do
we
that.
We will. But
Okay.
we are heading there.
Yeah. Allow me go through some of the feedbacks to anyalirasema mbiabono even as we go forward. Akoro kwa Kereri nago kwa neti mapema Fred Moga korwa nya Kenyo Misia Secondary no bali numero yo kwa Ruth Mora otebanga bakwera mega mangi Samuel omo science no ali korwa nya boterere bondo nya otebanga tokwa mega mangi Jeffrey Mogire no ali korwa Jeffrey Mogire no ali korwa chisemo chia Coast awotebengita TV breakfast show niko ndani kabisa naro kubuli bolio liriga waziri kwa Samson Mariba awoteba let him tell you why some public hospitals in Nyamira were revoked from using SHA. Ilibolia watanga some hospitals have been revoked from using SHA na enda kubuli liakaberenga measures that you are undertaking to reinstate them back for public uptake. Kuna hospitali zenye zimekuwa revoked from using SHA, and if yes, why, and what are you going to do to make services available for them?
Yes, a few, actually 3. Kiabet suspended, it's not revoked, Kiabet suspended.
Yes, yes.
Because in quotes, SHA claim being about fraudulent claims.
Yes.
But we are working with them.
Yes.
Because SHA sent auditors.
Yeah.
Waga audit those hospitals. The auditors gave out a report to a report to you. So where now we are is where we are waiting a decision here, the SHA board on reinstatement. And that is not only us. In Kenya, when they are revoking even private hospitals, you remember even Chwanja Vete revoked, I think, sometimes back.
Yeah, sure.
Even public hospitals undergo the same. Yes.
So you wait.
You make a mistake, you will be revoked. I think they revoked the MP SHA, Nairobi. So when they revoke, they've got to come back or audit. If it goes further, you can even be charged. This year you go because you go so as a DCI.
Nkikiragere SHA revoke a facility.
You see, in quotes, fraudulent claims. Let me give you a scenario. That we found which of course is something to assort. Omwana ole 16 years. Ochire nyagitari ne ade ko atake gonyoro omwana. Umwana tabwate kebande.
Yeah.
Amba tu SHA gotumia ne yangina. Batingo yoja gonyoro omwana.
Omwana bo.
So mwana 16 ngakiwo curriculum wiki.
Wow.
It means you curriculum wiki using Eritrea yangina. But you see what the curriculum kyo muswati yo konyoroma, but you know mwana. Because the muswati no mwana or labda even or school. Lakini bahati mbaya konyoro bulito. Kuchiri konyoro kwerende. Bone SHA gutumia ne ya
mamu wabo.
Mamu mwabo tali erole mulito. Kero kolgeli ke kwene ngokorite claim echiago iga omonto go claimeri osema mamu mwabo yo ari 56 years. So this what we have all ngachumongi no 56 years yakonyoro mwana.
Yeah, to a challenge.
Yeah, we challenge. So we've got claims. Then we knew the first 6 or 7 months. SHA.
Yeah.
That is where a lot of mistakes. A lot of mistakes happen, and that is what is also eating these 3 of our facilities. But we are sorting them.
Yeah. All right. Bia so kweresera yo kero ekwende eko revoked because of the claims chitaliko substantiated bono mne you. It's very genuine, by the way.
Because I remember those other days before June last year.
Yes.
Mwana ogori claim yasha mulikobeka medical records. June kekawa introduced dinga doctor's notes.
Yeah.
Goikachi chikoreki chibegu.
Yeah.
So any claim kita wate for that period, there may be 1 week before you got to know any claim kia wate the doctor's notes.
Yes.
Is a fraudulent claim.
All right.
Yes. So that is how you are revoked. But we are among several and so many hospitals in Kenya.
All right.
Revoked. But we are working on it's work in progress into Nasha.
Okay.
But that does not mean you can't get services in those hospitals. I told you we've got 116 facilities. 113 are working. If you require a service somewhere using SHA, you are able to access it. It's only that maybe you'll have to move a longer distance for the time being as Singapore Salty Mangana Inasha.
Okay. Mwabisanara ogaligotuchanda sana mayunga. So tuweza kimoko mokora. Tukwaniri sana watrende. We are here. It's a small office, lakini yagotuchanda sana. Anyway, that's just a by the way. Manchumo ligereria tole na waziri Dr. Donald Mogoi as Department ya Healthy na waziri wa Health as County ya Nyamira. You know, this is the goodness of them agreeing to come. So many, but they are obviously. Bakare obviously, bamuganyete bachigokora egento gekurukwa kibaguchi ku plan on recruitment of nurses kiagera mbabwate staff ya hoteli nene mono bunaeresa gucha so nakitokwa nasema mbia bono ne bintu binde they are underway muntu to gukwane egento taramanya what is really happening. This is what is costing us awata baya bachano bintu mbira korukende, but here now kwa mawacha konyorangi binte bigandete gokorwa emirobeli gera underway, other things byakoriru yaani vitu kazi inaendelea kabisa bono lini nakie kugera bacha baeresera na tolipobekera gukwane ndo tamanyiti lakini onekera kwa manyire okonyoraga mangana abeire bija iga account ya Nyamira mambo ni vulai asa mangana healthy na enda no inchi ninga chita mangana yobo chenu. I'm so much happy nga waziri anachapa kazi yake na watati laini yaye bunebwenerete koba ikiagara it's service delivery after all igara obisieri akorera aba Nyamire mirimu igabona mwanchu muligeria asema mbia bono na raitu kuna ukwanira ase chinga ki echi iga korokwanere Duke Tinega yamana mabisoyi akoroka Duke Tinega waziri agotebanga kusema ukweli Department ya Healthy iko sawa na huyo waziri Mogoi kusema ukweli amejaribu kufanya kazi Department ya Healthy abawatanga ekemene kerogitika tukwane you know asegende yake kolre let us say it na sekretara akorwa just critique it objectively nga waziri yaya asigete na ara itara koronye tara korona bakuru mirobeli what they have lakini etsekeri yakoriru sema tu imefanyika ndo kuburukania paka bacheno mangana siasa mete mondo na akora we don't recognize bakukana ngake
itara akor
kendenge yakoriru batyo bacheno botolengete intwe we must acknowledge yasibiri byakoriru. So thank you so much Honorable Duke Tinega mtetezi awathanekene umefanya kazi umejaribu kufanya kazi na amangana yo bachenu Nyamira County mbuyale kabisa. All right, keep them coming. Ninchi some kaltu wachideka nke tukuru murubulio tuti waziri amnyokarole abageni akabwate na ara utumire message entambe sana na ende ninga nirende enyesome kyagera ndabane fair utanyesoma agotebanga hey Shadrack hapa nimemsalimia mheshimiwa umesalimiwa sana wana kubolinga for many others akubolia bande walipata abuli lakini era ameuliza agoteba how is Nyamira prepared. I think inkwira neli lakini ntikatulisoma mbone gali tumire korambona achire how is Nyamira prepared in observing the UHC workers who have worked for the county for 6 years now. I think waziri alisema hiyo, but because you've come late and abana enda kuirora kiagera kwa take your time. 2 akoteba National Treasury set aside funds. Nyamira tulipata around 243 million. How are they planning to settle this? I know among the issues zenye zitafanya madaktari kugoma, UHC issue is one of them. Mbaro chengenge ntukilikira agera abanyagitari bagome UHC is one of them. Nechiwe sichia the treasury ya begeta aside for Nyamira. Bakanyorera na maite bakie namba. Ono tumeidi na yora ya confirm 243. How are you planning to settle this? Eh? You are kurkwanere Shadrach.
Sir, I think I spoke na kwa negoro ya UHC. It's a priority. Ekana kwa na mangana human resource.
Yes, yes. You.
To me, it's a done and dusted thing. We are converting them to permanent and pensionable. We have the money because it's factored as a conditional grant as a budget. Okay. That money, the 240, it's not 243, I think it's 241. But that's a small difference. So the 240 something million each year UHC is factored as a conditional grant. So it's there. Okay. So to me, there is no debate about the absorption. Okay. Yeah,
you will absorb them.
There isn't any.
To PP.
Yes,
PNP.
Permanent and pensionable. Yeah. Yeah. There is no conversion from transition from national government to county because that payroll has got to be transferred. And there is a process that is again wakikisha because that Nyamira yoka. It's across Kenya, all the 47 counties. Naki payroll will be transferred to Ministry of Health, HJ County. That will happen. Two, payroll will be transferred to HJ County. The next thing is they'll be given permanent and pensionable letters. All right. So tindo chinga and
don't worry
because completely.
All right.
It's done. The money is there. So it's implementation. Okay. Yes.
All right. Yeah. That's a good assurance. A morning, I'm from
and then now so they should continue working to me. Because the administrative processes will be done and dusted by just like the other county employees.
Na narulika the same I think kwa nyote the same answer kutoka kwa waziri abolinga morning Nchenkuru Nyamira Kimboleli waziri. Now that the Public Service Board is in place and the UHC staff have worked for 6 years in contract, what are they planning about them? A plan narrowing here and there is a good plan. There's a good plan for them. You continue working because the resources are available and now it's implementation, taking you to be PNP. You go, don't worry about that. Nyamira County. Biamono, thank you so much for watching. You will help me if we have some questions on YouTube. Kindly. Waziri, you said something about Kobeka. Is it a facility? You mentioned something like that.
What I said about Nyaribari Masava, you know, Keroka, it's a shared town. Nyekitari itasere, ere very strategic. And the kind of expansion to okora, ekarokorigereri abantu bari to serve, yes ngo serve to abantu ba Nyamira, lakini na abantu ba Nyaribari Masava, bari barange na Keroka. Including all the way mpaka naona abantu babo basi kurunya cheki. Possibly Keroka will be an easier referral facility for them. Okay. Yes.
All right.
So I'm saying abantu bari banyaribari Masaba, including abantu ba Kilgoris constituency. Bari ba Kilgoris. Accessing Keroka will be easier. So once Keroka got those facilities, specialists baroro, equipment chiroro, high-end equipment, then it will not only be serving as a Nyamira. It will also be serving abantu ba Kisii County na abantu ba Narok County.
Okay. Bia sana umetembea kubuli kiagera ochobe kirenta anyenchitinda nje kurwa Kisii County atena ki wacha buone.
No. I'll talk to our boundaries because running to abantu baito. Yes. Example abantu bari Getare. Kurifa umuntu kurgetare nga chiche Nyamira becomes very hard.
Agocha.
Ekiara kubuli nkinguchi kokora Nyamira.
Kokora Nyamira
general gerega less than 5 kilometers.
All right.
Yeah.
Bia maana sana. Waziri, what about those who were employed long time ago? Wali meremo bakuli misahara, but they're still in job group J. I'm very specific of the job group J. But Abomba be moved. One of the
promotions is
promotions
is an ongoing thing.
Yeah.
For clinical officers, very J to K is now common cadre. So that will be done. Yeah.
All right. What about the morgue? Mogoi to Nyamira.
The morgue is very nice.
Okay.
Very good. As to morgue in Keroka, but it's also a plan.
Nase mutabuatie yare tubukoleka nuguchikericho sijui nini. Cemetery. Nero na rekodi. You said gamubori abantu
mutwale. You know tiongo tevi Sara.
Yes.
You know nonyense itoga kisinto bwa cemetery.
Ntobwati na mwene.
Na unclaimed bodies.
Yes.
Echirolowa. So it's not a unique thing. Gotoa unclaimed bodies. Na wekachirwa cemetery asikite. So when you don't have a cemetery before, kodata tuaringi kisienene, tuabwate Nyamira. But Nyamira igaichora.
Yes, sure.
Nyamira, we've not set aside land somewhere, and possibly we will need to either buy or get it from the tea estates.
Yes.
To make a cemetery. So the closest place as a public cemetery is Kericho. Yes. That is the reality. Nonye niga seito Osongo. I don't know where they dispose the unclaimed bodies, but I can tell you nga. Yeah. Can I tell you, Sarah, how unclaimed bodies come in? It's not going to have Nyamira. No, taribantu Nyamira boka. You see what happens? Like those bodies kiachete Kericho. The adult bodies chiarenge chinyinge chiare tuna basigari. Omonto chire omonto kweto tokire egucha. So agundete. Tamanyiri igakore to as an unknown person. Obekwe mortuary. Aya. Na public mortuaries no police wakoira anybody. So no nyempo songo gaiga oni ogendo mortuary ya Busongo. Ogenda mortuary ya Omabay, ogenda mortuary ya Kericho. Ogenda mortuary ya Kisumu. You will get unclaimed bodies. That is number one. Scenario number two. You are those unclaimed bodies as a chimortuary. Sarah, abaswatu betongo nyora barabana basirira nyagitari. Kwa nyora iganyo amenyete etauni elandi. Egoro eliguro. Onyori mwana uyu utaraike ngakiri konya. Rumwana emitienyi saba. Mwana uri nane, mwana uri osire irororo. Intuna baguseka rubwate se inunki okora. Igukobeka rumwana uri kwa ira sinu. Ngwaje gutindeka. Barinde batabwati sobe gakaruse na iru. Bakoira.
You wana wepa na bako.
Uso ba mochari ukobeko. Ukobeko mochari. Kiartari mwana uri kirurieta. Ngogoje kumwe.
Hakuna.
Uraimo kwa soko chigare tebeti kwa mubikiro mochari turigocha kokora ikwene. Ania yagenda. Nkikike ko. It's an unclaimed body. Now, when you dispose, there is a procedure. So, no, you can't because we can't court in order. Order area with the court was very clear. We got dispose as a cemetery. As a problem, yes, what? Nekere me very okay. Environment. So dispose no nyamboniga. Ningenda mochari to ya Nyamira. Nimbuata unclaimed bodies.
Well, in the future, how will we handle this?
We must get our own cemetery.
You must get a way.
We must get our own cemetery. Or to Rossi crematorium. We cremate. But you see, when you get a queen, then we must do what? Because nobody more could be at your neighborhood. One jerane. To go public participation, one jerane ngaki. Gobe Catholic. Asymmetry.
Yeah, sure.
So it's not an easy topic as a communities. And that community, they will say no. So that is why in Tunga Nyamira, our consideration eventually, we carve off some small land as like a public cemetery.
All right.
But the reality is, even other counties, we all struggle. A cemetery. So if we don't get there, then cremation becomes an option.
Mbona wewe ni mchapakazi? Mbona tunaona unafanya hizi vitu zote, uko na mipango ya watu wenye Nyamira, uko na kila. Why are you so hardworking?
I don't know. I was not born to be lazy. I was born to work.
You were born to work.
I was born to work.
And deliver. But there's people who work and they don't deliver.
Maybe you don't have a plan and you don't have the knowledge.
What is the secret?
Have a clear plan.
Okay. All right.
And focus.
That's the reason. And focus.
Yes. Yes. And focus on your
plan.
Yes. Because if you see, you could have. You see, I told you there are a lot of things that we want to do. But when you focus that this is what we want to achieve, then we achieve this, it becomes easier.
All right.
Yeah.
Maybe that's the reason. That's the reason somebody's saying we want to pray for Waziri to be in Nyamira for a long time to enable us grow like other counties. Somebody's praying that you stay in Nyamira for a long time.
Amen.
So that
we say amen.
Okay,
As they're praying,
we
amen.
say amen.
Yes,
That's
they're
a prayer.
praying for good things for me.
Yeah.
Yes.
Hey, somebody's praying for you, Waziri. Must be a good person. Anyway, you're a good person. Ko anchira na gocha. Ocha kukwana na bantu ba wiga. Amidio bwate mekutani menge. Tunashukuru zaidi. I think we can end it here for today. Na the next time Nyasaye karanche. Na ende ntugu kurangeli Waziri.
No, I'm always available.
You're always available for us.
I'm always available.
Yeah.
You visit Nyamira.
Yes. I will come for that
You
program.
get more content. Yeah,
I will come for that. For bono ngyogote yumo Nyamira kuligeti asemambia bono, we are having a next financial year. Yani ntubwate a budget in place. What are you assuring them? Ever you are parting short.
Our assurances are to Nyamira. We are in place. We are focused. And iganga yetu no wakikisha ngo nyora muri quality care. On our healthcare system, on chinyagitari chetu CECM, na ninju onyoro bokonya chinyagitari au because abafanyikazi baito na system yaito no eno mugaba no ito igari focus lwakikishanga nkonyoro the quality care se Nyamira County. Yeah.
All right. Thank you so much, Waziri. Thank you for your time.
Thank you.
All right. Mwanchumo ligiriria tigatukulira abo asebono na biminto biko bekwa igo teneni waziwazi igo mwamanyanga what is really happening on the ground. It's not talking alone, it's not criticizing alone, it's not okura alone, it's going on the ground na kumanyangi kegendrete onye tumanyeti go to his office. Is your office open for another person?
Yes.
You don't need an
appointment. Ask any question.
Yeah.
As to what we will always strive to koramo.
Yes. Ni function gani mko nayo kesho? You having some function tomorrow?
Tomorrow, that is on Wednesday.
Yes, on Wednesday.
Agriculture what a function, I think, Mambia. A department of agriculture.
Okay.
I have not been fully briefed about it.
Okay.
But in what a function, Mambia. On Thursday, into what a function, Konyora na community health promoters.
Community.
Mandaktari wa mashinani. So on Thursday, all of them, the 1,379 community health promoters. For discussing this year.
All right. By the way, abanyagitari muna mugwena tukubwatenda kabisa. Ngo igumo kubwaka nenusu na serikali yabaka nenusu. Mwabaka rinde mapema.
We are doing our best.
And by the way, Waziri, there is this question. It's out of nini, but since you're here, mbona tunaona wewe uko kwa hiyo docket? Tunaona rishavu ikifanya wewe uko healthy. Mbona uko kusongeshi tangu kuje hapo?
Unataka nisonge?
No.
Do you want me to move?
No, we don't.
I think, also,
Yes.
I think consideration in covering where are you qualified to serve, and if you are doing possibly a good job, why move? But that does not mean I cannot be moved. Yes, sure. Because maybe my services would be required in another department.
Yes.
And it's the prerogative of His Excellency Governor to decide where you where you are deployed.
All right.
So if any department, you'll still see the same energy that you are seeing.
But remain there. That's where you qualify.
You'll still
You're a
see the same
technocrat
energy
there.
that you are seeing.
Hiyo inasaidia sana.
But remember also,
right.
as a minister, we work collectively. There is a whole of government approach. So sometimes you'll even find me in other departments. Nkokore bintu binde kweboring kia okora iga na ndore waziri ya health. So the cabinet is overall decision-making body. Now that cabinet, it's collective responsibility.
Okay.
So those decisions ecological were made, we implement them as a team.
All right.
Led by the governor.
All right. No, we pray for you, you remain there. Because you're a technocrat, wewe ni daktari, lazima ukae mahali unastahili. But rende ya oro kiringa, wherever ora abere, things can still work. Wherever you are. Anyway, thank you so much. Mzee wa kazi mbia mono Kigimana Franklin Mayunga. Thank you Ruth Aluda. Asante sana. So kwenekea nga tuwabwatira ni romo robulio beiru moikirano. Wabisambali wa machikoleta kuenda. Mzee wa kazi mba nchokanana sana. Tunashukuru zaidi. Kiagara lende na warumu batungire wa menya. So lende waziri mbia mono sana sa kwenye rachingaki. There is always again next time. Lakini kuruwa sekonti ya Nyamira, health status iko chonjo. Iko sawasawa, tuzidi kuwaombea viongozi. Wakati wanafanya kazi na wao ni binadamu lakini wanajikakamua yatobasabire all the time. Gandako bwatya Etaya TV obara ubagusi tomera naende anke mambe Jumatano asomoro bilyonga unoyoiga nchendoke mama Africa entinganeta breakfast show Sara Nyarangi Ontita tukarukuligereria orobia.
Asante kwa kutazama Etaya TV, obora bubwagusi.
Etaya TV. Oborabu